Hey everybody, welcome to Mind Blown. Today we're going to go over the top 7 facts that we should know about depression. Make sure to watch until the end, as we're going to give you some tips on how to take care of your well-being. In this video, we will present to you 7 things about depression you need to know. Before we begin, I would like to mention that this video is created for educational purposes only and is not intended to substitute a professional diagnosis if you suspect that you may have depression or any mental health condition. I highly advise you to seek help from a qualified mental health professional. What is depression? Depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. It is also a mood disorder that causes a persistent feeling of sadness and loss of interest. Also called a major depressive disorder or clinical depression, it affects how you feel, think, and behave, and can lead to various emotional and physical problems. You may have trouble doing normal day-to-day activities, and sometimes you may feel as if life isn't worth living. Fortunately, it is also treatable. Depression causes feelings of sadness and a loss of interest in activities you once enjoyed. It can lead to various emotional and physical problems and decrease your function at work and home. More than just the blues, depression isn't a weakness, and you can't simply snap out of it. Depression may require long-term treatment, but don't get discouraged. Most people with depression feel better with medication, psychotherapy, or both. Here are the 7 facts that you should know about depression. 1. Depression doesn't always have a specific reason. Depression can be for many reasons and will happen anytime. These reasons can be known or unknown. It can have many causes, all of which are complex and can be challenging to understand. In some cases, feelings of depression can be connected to an experience in someone's life, such as a tragic loss or a violent event. Other people may be aware they have a family history of mental illness, and as a result, may not be caught off guard by a diagnosis of depression. However, some people become depressed and don't know why. They may feel they do not have a reason to be depressed, especially if they perceive their lives as better than others. The pressure to explain or justify how they feel can make depression worse and may prevent people from getting necessary treatment. 2. Many factors can cause depression. Have you ever wondered what causes depression? Perhaps you've been diagnosed with major depression, and that's made you question why some people get depressed, but others don't. There are several possible causes of depression. Genetic. Depression may be an inherited condition. You may have a higher likelihood of experiencing a depressive disorder at some point in your life if you have a family member with depression. The exact genes involved are not known. It's believed that genes may play a factor in causing depression. Biochemical. Some people have noticeable changes in their brains with depression. Even though this potential cause isn't understood, it does suggest depression starts with brain function. Some psychiatrists look at brain chemistry with cases of depression. Neurotransmitters in the brain, specifically serotonin, dopamine, or norepinephrine, affect feelings of happiness and pleasure and may be out of balance in people with depression. Hormonal. Changes in hormone production or functioning could lead to the onset of depressive states. Any changes in hormone states, including menopause, childbirth, thyroid problems, or other disorders, could cause depression. With postpartum depression, mothers develop symptoms of depression after giving birth. It's normal to be emotional because of the changing hormones, but postpartum depression is severe. Situational. Trauma, a significant change or struggle in life, can trigger a case of depression. Losing a loved one, being fired, having financial troubles, or undergoing a severe change can significantly impact people. 3. Depression is more than ordinary sadness. Sadness is not a synonym for depression. All of us will experience sadness at some point in our lives, which is a part of being human, a natural reaction to painful circumstances. Depression is a condition that tends to last longer than simply having a bad day. It is an illness with many more symptoms than an unhappy mood. Sadness is sometimes part of depression regarding mental and physical symptoms. A struggle where you feel exhausted, have unexplained pains, and lose interest in your favorite activities. Unfortunately, you can't just snap yourself out of depression. If you recognize any signs, seek help from a mental health professional. 4. Children are not immune to depression. Children can also get depressed. Childhood brings its own unique set of stresses, such as bullying and the struggle for peer acceptance. One sign of this is withdrawal from friends and activities. Kids who are depressed also might start doing poorly in school. They often become irritable or have physical complaints. These symptoms usually are missed. Adults think the problem is something else. However, it should not be confused with normal moodiness. It's as real and as serious for children, even very young children, as it is for adults. It exists in some more youthful kids. It's much more common in teenagers, commonly by the age of 16. Parents should be aware of the actions and behavior of their children to avoid the worst thing from happening. 5. Depression is a real illness. Many people mistakenly believe that depression is mere sadness or even a weakness of character. But in fact, depression is a complex mental health disorder. Researchers believe it is a real illness caused mainly by imbalances in certain chemicals within your brain called neurotransmitters. The following neurotransmitters play an important role in regulating your mood and being involved in many other functions throughout your body. Dopamine. It helps regulate emotion, memory, thinking, motivation, and reward. Norepinephrine. It increases heart rate and blood pumping from the heart. It responds during a stressful event in your life. It's released into the blood as a stress hormone when the brain perceives that a stressful event has occurred. Serotonin. It helps regulate your mood naturally. When your serotonin levels are at an average level, you should feel more focused, emotionally stable, happier, and calmer. 6. Depression is treatable. There's no cure for depression, but there are lots of effective treatments. People can recover from depression and live long and healthy lives. There are several very effective treatment options for depression. Therapy. There are many types of therapeutic approaches depending on your unique situation. The most common methods used in depression treatment include cognitive behavioral therapy, interpersonal therapy, and psychodynamic therapy. What you learn in therapy gives you skills and insight to feel better and help prevent depression from coming back. Medications. Depression medication may be the most advertised treatment for depression, but it doesn't mean it's the most effective. Depression is not just about a chemical imbalance in the brain. Medication may help relieve some moderate and severe depression symptoms, but it doesn't cure the underlying problem, and it's usually not a long-term solution. Finding the medication that alleviates your symptoms with the fewest side effects may take some trial and error. The classes of medications commonly prescribed to treat depression include A. Esketamine, B. Monoamine oxidase inhibitors, C. Norepinephrine and dopamine reuptake inhibitors, NDRIs, D. Selective serotonin reuptake inhibitors, or SSRIs, E. Serotonin and norepinephrine reuptake inhibitors, SNRIs, and F. Tricyclic antidepressants, or TCAs. Lifestyle changes. Lifestyle changes are simple but powerful tools in the treatment of depression. Sometimes they might be all you need. Even if you need other treatment, making the right lifestyle changes can help lift depression faster and prevent it from coming back. Here are a few areas to focus on, but first, consult your mental health professional to find out if they are right for you. A. Diet. There is no cure-all diet for depression, but certain foods you can eat and avoid, playing a role in mood and emotional regulation. B. Exercise. A good workout can help lift your mood, reduce stress, and alleviate symptoms of depression. C. Stress management. Stress can trigger depression and intensify its symptoms. Along with the other good lifestyle, stress management can be beneficial. 7. Untreated depression is a common cause of suicide. Having major depression does increase suicide risk. The proper diagnosis and treatment of depression are essential in preventing suicides. Suicide is the fourth leading cause of death in 15 to 29-year-olds, including people with undiagnosed, untreated, or undertreated depression. If you have suicidal thoughts, contact the National Suicide Prevention Lifeline for support and assistance from a trained counselor. If you know someone who suffers from major depression, the number is in the description box below: 1-800-273-8255. Depression is genuine, but you should not fight it all on your own. Don't be afraid to ask for help. No matter how bad the situation gets, there's always hope that things will get better. If you are experiencing symptoms of depression, reach out to a psychologist or counselor and get the help you need to improve your life. While it might feel like you are depressed or sad for no reason, multiple causes may contribute to your feelings. Focus more on these underlying causes instead of looking for reasons for depression can be more helpful. If you have any doubts at all as to your ability to figure out and treat your problems on your own, seek the help of a professional. We hope we were able to give you further insights into depression. If you find this video helpful, be sure to hit the like button and share it with someone who needs to hear this. Subscribe and hit the notification bell to get notified whenever Mind Blown posts a new video. Thank you so much for watching.